So good morning, everybody. And again, to all the essential employees out there, thank you for what you're doing. To all the hospital staff, thank you for what you're doing. Thank you to everybody. And thank you to the people that are staying home and doing the right stuff. I can't thank you enough. But sadly, we had another person in Albany County, a resident, die overnight, a man in his 80s with multiple underlying conditions. He had been a resident at our Shaker Place, but he was transferred to the VA hospital, and our condolences and prayers go out to the family. That brings us up to 59. And to the 58 families yesterday, again, our hearts go out to you and our condolences and our prayers, because this is a difficult time when you lose a loved one. And I just want to remind people again, like I say, when this unfortunately happens, that these families can't say goodbye in the right way. They can't have their last moment with their loved ones and give them the proper funeral services and stuff because of what's going on. So again, through these difficult times with everybody, but more difficult times when someone's losing somebody, our condolences and our prayers are with you. So today we have 1,336 positive cases. We have 966 people under mandatory quarantine, and we have 15 people under precautionary. So that's an increase of 27 positive cases from yesterday, which is good news, which we've been talking about the last now 7 days, it seems. We've been averaging roughly about 20 new cases a day. So are we on that? Did we hit our APAC? We're down the slope. Time will tell. We've been aggressively with the testing, so I'm very pleased to see these numbers are low. That means that people are doing the right stuff and they're listening to everyone out there telling you to social distance, to wear a mask in public, to clean your hands and cough in your arms and do the right stuff. So it has to be working, so thank you. Also, some really good news. We have 3,083 people have completed quarantine, and that's up 104 from yesterday. And we have 799 who tested positive for the virus and have recovered. That's up 31 from yesterday, which is good news. That's an increase, like I said, 31 over the since this has all been started since yesterday. But we have 28 people in the hospital with a hospitalization rate of 2.09. So, which is good. That's going down. We currently still have 6 people in the ICU, which is the same as yesterday. And again, it's, I kept looking at the number and I'm like, 59 people passed away and this is the 59th day. It's surreal what's going on here in the Capital District, in Albany County, in the new way we have to deal with things. The way the new world's going to be when the doors finally open up and we re-enter society and we start doing things differently. It's going to be a hard adjustment for a lot of people, but we'll get through this. We're all good New Yorkers. We're good residents of Albany County, and we have each other to lean on. So just, again, to remind everyone, it's a marathon. It's not a sprint. Take a step back, take a deep breath, and we'll get through this together. So some of the things we've been talking about, the Capital Region economy, talking about how we're going to reopen up. The 15th of May is right around the corner. How are we going to do this? And I've said this before, so I hope people are listening. We're going to do this safely. It's about the safety and the health of the residents first and foremost. And again, if our numbers spike, if things spike up, we're not going to be able to open up. If we're not doing what we need to do to reopen up, we're not going to reopen up. This has to be done in a way that it protects everyone going forward. So, one of the things that I know is we've been very aggressive in this county about setting up testing. I've worked with Schenectady County, Rensselaer County, and now I'm glad to announce, we are going to be doing testing in Queens next Wednesday morning between 9 a.m. and noon. So we're going to be down in Queens for the first time, and we're reaching out to other parts of the community that people might have a transportation issue, or just don't want to drive to UAlbany, or don't want to go someplace else because they want to stay safe in their community. So we want to make sure that we touch on all this. So we'll be putting that number out in a minute, but that's going to be part of our mobile testing sites that we're going to be expanding on next week. So, and again, I want to thank the supervisor down there, George McCoy. He was worked with us hand in hand to make this happen. So George, thank you and your team down there for everything that you're doing. Also, we have to be helpful for, we'll be working with Green in Columbia County as well. If we want to reopen up and we have to do this, we have to do it as a region, as everyone's aware of. So we've been reaching out to the other counties, talking to them about a plan. And actually, I had a meeting yesterday with everyone except Greene and Washington was the only two counties we couldn't get a hold of. And so I'll say this to the press, to everyone out there, please, if anyone's watching from Greene, Washington, call my office. Area code 518-447-7040, so we can get you up and running, because we have to submit this as a region, and we have to be all on the same sheet of music if we want to open up in a safe way, and if we want to work together, we have to be in this together as good neighbors. So please, my office has been trying to get a hold of people in them counties, and I know there was other supervisors and county execs on the phone that were going to reach out to them too and get them to participate. So again, if you want to use our mobile testing sites, the number's area code 518-465-4771. And as we discussed yesterday, and Dr. Whalen discussed about the Albany testing site that's going to be expanded, please, we got a chart up there how to get tested for that, but that's really going to be for essential workers and healthcare workers and people that are on the front lines, so we can start opening up and get back to work. Also, Rite Aid, www.riteaid.com. As always, you can go on there and schedule an appointment for there, and then we still got the urgent care in Gilderland. So again, to reopen the capital region economy quickly and safely, it's becoming more and more important for us to get more testing out there and to work together. And the only way we're going to do that is in a partnership and by being patient and being part of the solution, not part of the problem. So if you have, we've gotten some really great feedback from a lot of people on ideas, and I want to say thank you, because some things we're not going to think of everything. Everything's not going to, there's going to be things you overlook, and it's not that you're trying to, but when we're moving in this quick environment, I want to give a shout out to the Board of Supervisors Chairman, Matt, down in Columbia County, who brought up an excellent point yesterday that we didn't even think about. So Matt, thank you for that input, and now we added it to our plan. But unfortunately, yesterday was a historic day in the United States, Reports from April showed that the U.S. unemployment rate rise to 14.7%, the highest level since the Great Depression. Think about that. The highest level since the Great Depression. We lost more than 20.5 million jobs in April alone. Compare that to the 8.7 million we lost during the recession. So that's alarming. These are things that we have to work with, and that's why I said we have to get the mom and pop stores back up and running. We have to work with the businesses because, we want to do this right, and we want to make the right steps to go forward. And the only way we can do this is, again, working together, but we have to eventually get the economy back up and running, or you're going to see more of this. You're going to see more people unemployed, more stores that aren't going to be able to reopen up their doors if we stay shut down more. But again, it has to be done in a safe way. When we look at the 4 phases of reopening for businesses, the governor has laid out over 50% of Albany County jobs won't be open until the second phase, and the second phase under his plan would be around June 1st. So that's a big one we have to work on, and them jobs come from retail, finance, real estate, technical services, and professional services. So that's June at the earliest under this plan. And again, we are going to be aggressive in submitting a plan before the 15th. And it might not be perfect. We might miss some things, but we'll be able to readjust it, and we'll have a plan to the governor's office and to the RADC before the 15th so that they can review it, they can go through it, and they can decide where we're at. So that's one of the reasons why I asked Kevin O'Connell to be here, so we can talk about what are the guidelines going to be, what are we going to do in the business community, and some of the business owners have asked us, what are the new protocols going to be? Well, we know definitely social distance in restaurants and bars. That means taking temperature of your workers when they come in, maybe taking temperatures of people when they come into your establishment, making sure they have masks on, making sure everyone has gloves serving food, or your wait staff has mask on when they're serving food, your cooks. These are things that we're going to have to look like going forward. The same thing when I start to bring back the workforce here in Albany County. We'll be taking your temperature. We'll be making sure you have mask on. We'll be looking for signs and symptoms if you're not feeling well. If you're not feeling well or you're not feeling good, stay home. And this is a hard time too, because we're just getting out of the flu season. Now allergies are here. My allergies kick in every time around this time of year, where my eyes start to water, you get the cough, you're sneezing, and people are scared. Like when you're walking around, someone coughs or sneezes, everyone just starts turning their head. Because, again, everyone's scared and no one wants to get the coronavirus. But these are uniform rules and guidelines that have to apply to all 8 counties in the region in order for us to reopen up. So, who better than to come in here but our County Economic Development Director, Kevin, who we brought on board at the right time, but was the chair of my advisory committee over a year ago that was guiding us of, looking at opportunities of expanding companies here in Albany County, bringing new companies here and opportunities for the people of Albany County, working with the Moines Association, which I announced that, that report would be out, and it came out, and it couldn't have come out in a better timely manner than it did. But Kevin, please explain to what we're doing and actually all the good stuff we're working on to reopen and do it in the right way. Kevin?
Thank you, County Executive. Good morning, everyone. At the County Executive direction, we've been convening meetings with area business leaders, and as the County Executive said, we got some great feedback. I think that without exception, the businesses that we've talked to want to do the right thing here. They want to instill a sense of confidence in their employees so that they come back to work, and in their customers so that they patronize their establishments. We've got some industries that have been harder hit than others. A hospitality industry, bar, restaurant, hotels alike, and some of the so-called non-essential retail been hit very hard. They're very anxious to get back open again. But again, I think these people are, again, without exception, want to do the right thing. They want to make sure that they open and they're able to stay open. They all understand that the worst thing that could happen was that to have an opening and then a resurgence of the virus and have to be shut down a second time. That would almost be worse than not reopening in the first instance. So we've got a lot of good feedback. We've been giving it to the county executive and to be put into the plan that hopefully we'll be submitting this Friday. And I think we're in good shape on that. The last thing that I'd just like to add here is that similar to the public health side, the devastation that this is doing to the livelihoods of some of these business people out there is just hard to grapple with. It's people's lives are seemingly evaporating beneath them, and but still, with all that said, everybody knows they have to do the right thing. Our guidelines will probably follow very closely to the CDC guidelines that have been developed. And some other things that I think we've kind of got a unique and novel way of looking at it. So I'm confident that we'll have a plan that will work and reopen in the right way and in a smart way.
Thank you, Kevin. And again, this is going to be a partnership. We all have to be on the same sheet of music, because if we're not working together, we're not going to be able to reopen up. And with obviously, getting that testing done on a 8-county region is going to be tough, but we're going to do this together. And we're going to do it together from people out there. So, again, I want to give another homework assignment to everyone sitting at home. And basically, if you have any plans or anything that could help to us to reopen, or what you think could be done differently, please submit it to us. because I want the input from everyone, because the only way this is going to work going forward into the future, to reimagine how the workforce is going to look at restaurants or movie theaters or malls, is that what people feel comfortable going back out to. What would make you comfortable going to your favorite restaurant, or going to Cross Gates, to go shopping at Stuyvesant or Colony Center or Wolf Road? What's going to make you feel safe when this opens up, that you feel comfortable going back out shopping? So any suggestions that you have will help us going forward. Also, people are asking where they can buy masks. CVS drugstore has it, but also it's out on Facebook and other sites. You can buy locally here in Albany County. There's a lot of businesses. We'll get that slide up for you and where you can purchase them. So I know that's been an issue for people. And again, to our family out at Shaker Place Nursing Home, our heart goes out to all the workers out there that are going out there day in and day out, 7 days a week, 24 hours a day, taking care of our residents that, again, are a fabric of our community. And I just like to point out, we're trying to be the most transparent we can of any nursing home operation, not just here in Albany County, but across the state. Because under the guidelines, someone asked me this yesterday, I go, we wouldn't even have to put anything out. So unfortunately, the 9 residents that we lost, anyone that passes away, unfortunately, in a nursing home under 5 doesn't have to report it, and till you get to 6. And if they pass away in a nursing home, you don't have to report it against your nursing home, which we chose to, because it's right. They're our residents, they're our family, and we're going to take ownership of it, and let the families know that they're getting the best possible care that we can give them.